Hello, and welcome to our Bridging Specialties program on bronchiectasis and NTM. I'm Dr. Ashwin Basavraj, Associate Professor of Medicine at NYU Grossman School of Medicine and System Chief of Pulmonary Medicine for New York City Health and Hospitals. Joining me are two patients with bronchiectasis and NTM, Mamie and Julie, who will share their experiences so we can learn more about some of the challenges our patients with bronchiectasis face on a day-to-day basis. Mamie and Julie, thank you for joining me.
You're welcome. Happy to be here.
So let's start with some of the patient experiences and challenges our patients with bronchiectasis and NTM may face. And this is a question both for you, Mamie and Julie. Can you describe your experiences with bronchiectasis and NTM?
Yeah, sure. I'll jump in. At first, it was all about the infections. Pneumonia was the star of the show. And for a very long time for me, about 7 years, I had 2 to 3 cases of pneumonia a year. And that captured my full attention. In hindsight, I realized that it was sort of a mistake to treat each one of these as sort of a discrete event. And I do wish that I'd had the knowledge I now have and could have seen it as something that was going on underneath. And that something is bronchiectasis, I've since learned. It's the underlying cause for all those recurring infections, and it's what I have to grapple with now on a day-to-day basis. This realization has come to me gradually, but it's important now that I know that bronchiectasis can't be fixed, that its impact is large, that it increases my susceptibility not only to NTM, nontuberculous mycobacteria, but other serious pathogens. I'm thinking of Pseudomonas here, that it can only get worse, and that I only have one set of lungs. So it's really now focused my attention on 2 important approaches. First of all, airway clearance, and secondly, to the extent that I reasonably can, to reduce my exposure to pathogens in the environment. These are my first 2 defenses. This is the change it's made.
And Julie, can you describe your experiences with bronchiectasis?
Yeah, like Mamie, I hardly recognized that bronchiectasis, it's only recent recognition for me that bronchiectasis is sort of at the bottom of everything. When I was diagnosed with NTM, I was asymptomatic. I had a routine physical because I was volunteering at a hospital. And when they did the chest x-ray, they saw bronchiectasis. And so the search was on for what's the problem. No one kind of mentioned bronchiectasis as a disease. And so the focus, once they diagnosed NTM, the focus for years was controlling the NTM. But now that my NTM is stable, I still have flare-ups of my underlying Pseudomonas infection, for which bronchiectasis is responsible. So now I realize bronchiectasis is a real key. My primary care physician has basically left all my lung care to my pulmonologist. So that's not something that I deal with my primary care physician. But the shortness of breath, the fatigue, the infections are all because of the bronchiectasis. My NTM is still positive, but it's not active and I'm not symptomatic. And I'd just like to add that I had the opportunity to testify at the FDA about 10 years ago for a drug that is used to treat one of the conditions that I have. And when doctors and other advocates talked about bronchiectasis and the similarity of symptoms between bronchiectasis and NTM, then I started to realize, bronchiectasis is a disease just like NTM. And I'd been thinking of bronchiectasis as a static state that was associated with NTM. So now I think bronchiectasis is my primary problem today.
And we know, when there's bronchiectasis and infections, as you mentioned, Pseudomonas, MRSA is another common infection, and NTM is very commonly seen with bronchiectasis, especially in the United States. There are challenges that patients can face on a day-to-day basis. Now, Mamie, can you describe some of the challenges that you face on a day-to-day?
Yeah, absolutely. Absolutely. And my bronchiectasis is relatively mild, but certainly I think what I experience is common. First of all, getting your head around the fact that you have a chronic condition that's not obvious to the rest of the world carries with it a psychological weight that has to be dealt with. And maybe that, in fact, is another conversation at another time. The more logistical and practical aspects of this, though, have to do with the fact that because of bronchiectasis, I've made a commitment twice a day to do airway clearance, which means that for, in my case, about an hour in the morning and about 2 hours every evening, I spend my time nebulizing and going through a series of breathing exercises that allow me to keep my lungs clear. That's had quite an impact on my ability to live my life in a normal way. I've had to make adjustments to my social life. It's had an impact on my ability to travel because I am carrying along a nebulizer and I'm carrying along equipment to make sure that I have clean water available to wash my equipment as well as drink. And that kind of adjustment can be a challenge to adapt to. And in fact, it's kind of an ongoing challenge. When I think about that, I really think it's important to spend some time making that kind of psychological shift to, if not acceptance, at least an adaptation that allows me to still feel to some extent in control. But having to decline invitations in the evening or modify those have presented somewhat of a struggle. Yeah.
Yeah, we know although airway clearance is one of the mainstays of managing bronchiectasis and very important to try to inhibit the vicious vortex that can develop, there's a time commitment and it's an impact on a day-to-day life. And oftentimes as a provider, what I tell patients is, choose the airway clearance technique that works best for you, right? That's the one that you should really be sticking with. So, it's oftentimes, picking and choosing which, technique and treatment works best for which individual patient.
I can add something there. I'm retired now, and I stopped working because of my health. So I'm retired on disability a couple of years ago, and I had a really stressful job, very long hours, a lot of stress, and I did almost no airway clearance and very little exercise in that time just because I was so stressed, and my health got worse and worse and worse until I had to stop working. And so now that I've got the time, I can take care of my health, and it's a huge time commitment. I don't do it twice a day like Mamie, but I don't make appointments before 11 o'clock. And even sometimes it's hard for me to make an 11 o'clock start, and just because daily exercise, daily airway clearance, yeah. No, it's hard when you're working.
Yeah. So we know that, there are day-to-day challenges, and there's also challenges in terms of just diagnosis of bronchiectasis. This is something that we're trying to improve on as a community, and really try to, get to the diagnosis at a much earlier state. Now, Mamie, how important is it for you as a patient to have an early, accurate diagnosis? And, that often, includes sputum cultures, right? Which could be a challenge in the community.
Yeah.
Thinking about, your experiences there.
Yeah, certainly. I mentioned earlier that I was having recurring cases of pneumonia over about a 7-year period. During that time, I was a fairly persistent patient. I really believe in self-advocacy. I believe in educating myself. And, I was marching out there trying to figure out what the heck was going on. And in the course of that time, I probably saw a dozen physicians in 4 specialties, plus a handful of visits to urgent care. No stone was left unturned. But it's really, really in hindsight that I recognize if we had begun to look for something underlying all these sporadic sicknesses, I could have gotten much quicker to the right answer and the right care. For a long period of time, for example, I was seeing a gastroenterologist, and I was headed for stomach surgery because there seemed to be some evidence that maybe that was at the bottom of the pneumonias. But thank heavens that proved not to pass. Did you try again? That proved not to be the case. And I eventually did get a bronchoscopy, a CAT scan, and the proper sputum samples, which finally took me to the right specialist. I'm lucky I can bring up sputum fairly easily, but that is not the case for many, many people. And so to have available the equipment and the expertise within a primary care physician setting or a clinic setting, that could really go a long way in helping someone get the right diagnosis in a timely way.
Yeah, you're exactly right. And, we oftentimes see bronchiectasis get misdiagnosed early on, right? So patients with a chronic cough, sputum production, frequent pneumonias, sometimes they may get diagnosed as COPD and asthma, but oftentimes it may be the bronchiectasis that's causing those symptoms. So really having a high index of suspicion, if it's not fitting, the history of COPD and asthma, checking a CAT scan early to try to diagnose bronchiectasis is important. And checking the sputum cultures early, specifically the AFB sputum culture to detect for NTM is very important too, because once we have that diagnosis of bronchiectasis or NTM, it really can change the trajectory for the patient. Now, it's not just bronchiectasis and NTM that we see, but these patients can oftentimes have frequent flare-ups or worsening of their symptoms. We call that bronchiectasis exacerbations. And oftentimes when we see bronchiectasis exacerbations, we treat for the underlying infectious process, although there are anti-inflammatory therapies that are in the pipeline that can help with bronchiectasis exacerbations. But Julie, can you describe your experience with bronchiectasis exacerbations and the frequent antibiotic use that can come along with that?
Sure. I just want to say for the record, it's been a year since I've had a bronchiectasis exacerbation. So shout out to daily airway clearance and exercise and taking the time.
Really?
Yeah, it's awesome. Wondrous. But before that, I had flare-ups twice a year, maybe 3 times a year. And for me, it's a sort of a gradual loss of energy, increased fatigue, increased coughing, increased sputum production. And I'm a little bit of a minimizer. So I go, oh, I'm tired because of this, or I'm coughing because it's allergy season or whatever. So, and eventually I hit this malaise, which just flattens me. And then I know for certain, oh, this is a flare-up. I don't get that fevers or chills or night sweats, which certain other people do. I just get that really awful, like sick, I can't do anything feelings. That's the deciding factor to me. And that's relative to my good state, which is also with some reduced energy or unpredictable energy. I have good days and bad days. And I think for me, good days and bad days can be a little bit more profound than they would be for a healthy person. Like everyone has good days and bad days, but a bad day for me means maybe I cancel what I plan to do and just rest at home. So I track how I feel every day now so that I'm not left wondering, how many days have I been tired? And that's, I think, going to help me arrive at signs of an exacerbation a little bit earlier. For me, the seriousness of the exacerbation isn't always quantifiable in that it's not always matched by my sputum culture results. My sputum cultures sometimes say many Pseudomonas, sometimes innumerable Pseudomonas, sometimes moderate Pseudomonas. It's the malaise that's the deciding factor, and thankfully my pulmonologist believes me. I've worked with her for a long time. And so when I feel unwell, they don't question it. So for me, I feel really unwell, and then the treatment for me is an IV course of antibiotics because I'm allergic to the common oral antibiotic that's used to treat flare-ups. So then I have to make a radiology appointment, get a PICC line inserted, work with the infusion center, either depending on what insurance covers, either at an infusion center or with a home visit nurse. And, that's self-injecting or IV push twice a day for 2 to 3 weeks. And I usually feel pretty terrible for the first 7 to 10 days, and then the meds kick in, and then I start to feel better. And then I have to build myself up again, because in that time I've lost many of the gains that I had made with, my daily exercise regimen. When I started on the NTM antibiotics, which was in 2010 for me, so it was a long time ago. I met with a nutritionist and a couple of other providers who really helped me with dietary factors to cope with antibiotic use. So I really prioritize my protein to reduce the yeast infections. I take probiotics. I still eat pretty carefully because I'm currently on an inhaled antibiotic 2 weeks on, 2 weeks off, which is designed to prevent Pseudomonas flare-ups. So far, I think it's successful. So I take a lot of antibiotics all the time. So I take probiotics all the time. I eat a lot of probiotic food. I try to be really careful about that. And I recognize that no matter what we do, I'm never really going to cure or get rid of that Pseudomonas. The best we're going to do is manage it and reduce the flare-ups. Does that answer the question?
Yeah, absolutely. And, you mentioned the importance of antibiotics, and we know that airway clearance is, important as well. But we're starting to understand the importance of inflammation in bronchiectasis. And really there's hope that targeting, inflammation, and predominantly neutrophilic inflammation, can really try to prevent some of these flare-ups from occurring. And, the more that we can prevent these exacerbations from occurring, the improvement in quality of life and symptoms, and mortality can occur in our patients with bronchiectasis. So exciting, time right now in bronchiectasis for the many possibilities, that are in the future.
I can speak to that, just having had this 1 year without an exacerbation, which I haven't had within, I can't remember how long. But certainly not since I had stopped working. And the quality of my life has improved so much with 12 months flare-up free, exacerbation free, just to be able to build up even more than I had ever been able to build up before. So now when I get my next flare-up, even if I lose function, I won't go hopefully as low as I've gone in the past, because I'm working on a stronger foundation.
It's amazing.
Thanks to a longer time without a flare-up.
It's great. Now, Julie, you mentioned, communicating, with your provider, which is very important. Can you talk a little bit more about, just why, communication with your healthcare provider is important in bronchiectasis?
No, 100%. Having a doctor that I trust and who is responsive and caring and has a practice of people who are caring is so primary for me. She believes me, even if the sputum culture doesn't come back as huge numbers of Pseudomonas. She doesn't belittle my symptoms. I had a pulmonologist before who used to say, when I tell her I was fatigued, she'd say, "Oh, well, everyone gets tired." It was like there was in a pulmonologist, no understanding of the difference between being tired and being fatigued. So I never get any feeling that what I'm going through doesn't matter. My doctor has sort of taught me to contact them. As I said earlier, I'm a little bit of a minimizer. So, if things don't change, I think don't bother her. Now I bother. And, I'm not on the phone every day, but also I think each patient is unique. And so education is critical, that is tailored towards each patient. And I know that my doc, when I've talked about other people I know with this disease who have XYZ, she's very aware that we're all different. And, she knows what's going on with me. So she, I had to learn, proper environmental management and, all of the other airway clearance and exercise and things like that. And having someone who's willing to repeat and encourage and draw connections, you're feeling like this because, maybe if you did this, it would feel better. And then being able to refer to other experts like respiratory therapists or gastroenterologists because I have GERDs and that's associated with bronchiectasis. And I think I think open and invited communication is important. I'm certainly not the only person that doesn't want to complain, doesn't want to bother my doctor. There must be more people than me that don't want to do that, or who minimizes my symptoms or tries to think, oh, there must be something else that's going on. I think it's really important to get support when we need it and intervention that we might delay. My doc will say, let's watch it for a day and then do this, and I might in the past not have even contacted her. So, and then I think the last thing is that doctors need to believe their patients because we know how we feel. I'm not going to tell you how to treat me, but I know how I feel. And if I feel absolutely terrible, then, you can't, I don't think it's helpful for you to tell me, oh, I feel terrible too. Like it's not going to be the same. So.
Yeah, and you mentioned, your healthcare provider being a, important source of information, and we know that there's a number of other resources that are out there. So Mamie, can you highlight some of the resources that are out there for bronchiectasis today?
Yeah, absolutely. And I do so with a great deal of gratitude because I was presented, once I finally got to the right place with the right diagnosis, I was presented with these resources, which gave me back a lot of agency to be able to participate in my own wellness. This is a disease that's very difficult to diagnose. As Julie just says, it presents uniquely for each patient. The side effects of the multiple antibiotics that are required are enough to make someone run in the other direction. And so learning about the disease itself and the various treatment options ends up making patients more confident and more compliant. A couple of organizations to mention right off the top, there's an organization called NTM Information and Research. They're at ntmir.org. And Bronchiectasis and NTM Association, and their website is long, Bronchiectasis and NTM Initiative.org, all spelled out. Those have very deep benches of patient education materials. They offer frequent webinars and videos, and they both have social media forum, which allow people to log in, ask a question, and get the answer from people who have real life experience with this particular disease, its treatment. Additionally, an association in Australia has the Bronchiectasis Toolkit, and they're found at bronchiectasis.com.au. Again, numerous videos that help people learn how to do airway clearance. And for individuals who are not near a major center, they might not have access to a respiratory therapist. Seeing a respiratory therapist on a video show you how to do autogenic drainage or the active cycle of breathing, that can get you going in a way that you can't do on your own. But finally, my real lifeline has been membership in support groups. NTMIR supports a number of support groups in the US and around the world. They meet virtually and they meet occasionally in person. This gives us an opportunity to go beyond the isolating factor of this disease. It's a place where we can find balance, share similar worries and concerns, envision new options, borrow strategies, make connections, expand knowledge. These groups really fill a void that medicine wants to fill but can't always fill and maybe shouldn't fill. It's real human-to-human therapy, and it's been an incredible resource for me.
Yeah, and you mentioned the Bronchiectasis and NTM Association, which came out with the announcement of centers, clinical centers of excellence for care of advanced bronchiectasis and NTM. So when there's help that's needed, specifically in the community, where advanced therapies or access to clinical trials are needed, you can visit the Bronchiectasis and NTM Association, and then it'll list some of those centers that are close to you, so patients can seek care there if needed for additional support. And we're also hoping, with the development of these programs through the Bridging Specialties program through CHEST, that will be also an additional resource for providers and for patients that they can visit to learn more about bronchiectasis and NTM. But that was definitely some helpful insight, Mamie and Julie, and thank you so much for sharing your personal experiences that you've had, both with bronchiectasis and NTM. Thanks for joining us.
Thank you so much. It's a pleasure.